Hi, folks. Steve Urban here, host of the Riderflex podcast and founder and CEO of our day job recruiting firm, Riderflex. We hope you enjoy this episode. And as a reminder, please subscribe to the podcast for updates and news. Finally, if you haven't already, check out the series of books we've published on hiring, interviewing, and overall career advice titled The Riderflex Guide, available on Amazon. And now, a quick word from our sponsor.
Most homeowners don't have the time or expertise to properly take care of their home, which causes costly issues to arise. That's where Cura Home Maintenance comes in. We're a full-service, routine maintenance company that was developed by a certified home inspector. Each quarter, we service our clients' homes following manufacturer's recommendations to properly maintain all the necessary appliances. We provide the materials and expertise to prolong the life of your property, creating a healthy and efficient environment for your family. From top to bottom, we'll maintain and service your home. To get started, we have a property inspection to determine what needs to be maintained, and a maintenance plan is created based on your preferences. From refrigerator coils to filters, vents, and drains, we do it all, and we do it well. Contact us today for your free routine maintenance inspection, and never worry about your maintenance again.
All right, man, you ready to rock and roll?
Yeah, let's do it.
All right. Cameron Carter on the Riderflex podcast. Hello, Cameron. How are you, sir?
I'm doing well. Thank you so much for having me, Steve.
Yeah. Are you in Denver, Colorado?
Based in Denver, just outside, so in the Centennial area.
Centennial. Okay, very good. I'm up near Loveland, Berthoud, Johnstown, a little up north. Now you went to CSU, so I know you know where all those exits are.
100%. Yeah, we were off at exit 69 and was over by the mall and was at CSU for 4 or 5 years and enjoyed it. Still proud Ram. Did track up there, so definitely sort of invested as far as athletics go and wishing for a bowl game and things like that and a good basketball season, a good track season.
I saw that. I saw you ran some track up there 4 years as a letterman. So does that mean you're an All-American or no? Let's see. I guess you got a place to be an All-American, right?
Yeah. Wasn't an All-American.
Still.
All conference with the Nationals, threw the discus and the hammer.
Oh, did you?
Cool. I was able to train with probably one of the top discus throwers in the world and CSU alumni, Casey Malone, who was at 2 Olympics for the USA. And then one of my teammates, Sinead Deloach, who placed third in the long jump in the London Olympics, was my teammates there. So people don't know about CSU, particularly CSU's track, is that we've had a representative in the Olympics in track and field every Olympics this century.
Did not know that. Interesting.
The last Olympics we were at, we had 5 representatives in 5 countries. So a little diamond in the rough as far as what's going on in Fort Collins and what's going on with the CSU track and field team.
How about that? Did you grow up in Colorado or you were recruited to college there from somewhere else?
Yeah, I was recruited. So grew up in Southern California, just outside of Los Angeles in a city called Compton, California.
Okay.
Big track and field, it's like take high school football in Texas. That's what track and field is in California.
Okay.
So I was able to be exposed to a lot of great opportunities. And then, when I graduated from high school, had a number of offers, and Colorado State made the most sense for me and my family, and also my opportunity as far as moving forward. And then took the leap and, flew into Denver and made that good hour and I don't know how many minute drive up to Fort Collins and loved it. Loved my time up there.
Yeah, it's great. Northern Colorado's great. Of course, it's getting busier than hell now. I'm sure. I don't know if it was the last time you've been up north, but wow. Holy cow.
I always tell people when I was leaving school, I remember driving past Timoth and going down like Mulberry and just seeing like these like
fields,
land movers kind of going out there like, well, one day it'll be a thing, maybe. And now you come up, through I-25, you see Fort Collins, and even not even Fort Collins, but Johnsontown, Loveland, and others. It's a whole community up there, which is great because not everybody can live in Denver, nor they should. And but to your point earlier about Northern Colorado, has a lot to offer. I'm just glad a lot of people get to be exposed to it and get to enjoy it as well.
Yeah, I'm a huge fan. Had you been to Colorado when you flew out to see the campus? Had you been that direction before, or that was your first visit?
It's a great question. I'm pretty sure it was definitely my first visit where you spent some time. I may have driven through at a younger age, but yeah, it was my recruiting visit, and then when my dad dropped me off a year later.
What'd your folks do? Yeah, talk to me about your parents.
Yeah, so mom, by way of East St. Louis, came to California and spent about 45 years at AT&T doing technical work.
Wow.
Started doing 10 key when she was 17, so just putting numbers in the phone book. And then when she retired, she was helping commercial real estate development install AT&T telecommunication services throughout their infrastructure. She retired, went back to school, did medical coding and billing, kind of a little bit, line of what I was already doing. Did that for a number of years, and then now she works at the ports, and she works at the cruise lines, which is funny because she gets significant discounts on cruises. She pulls passports and all that a couple of days a week, but the real opportunity, she was just in Italy with my sister this past summertime, and I'm like at work being like, what the hell? And my dad, he's been in the insurance sales his entire career, just about. Was one of the first agents to ever sell Medicare Advantage products in Southern California. And then from there to life insurance. He's been doing that for pretty much all of his entire career. And then now, odd jobs here and there, kind of hangs around, just most of the kids' work. And it's pretty cool just because, seeing their work ethic, seeing their commitment to excellence is something that I've always sort of instilled. And I think for both of them, they've been mindful. So the narrative around delayed gratification, which learned a lot in track, where do all that stuff in the wintertime to get prepared for the springtime. And now as an entrepreneur, and for both of them saying, hey, his first couple of years, lock in, do what you got to do. In years 6, 7, and 8, you're like, oh my God, this is crazy. You're successful. It's an overnight success, but it's going to take you some years. And I think for both of them, they've been able to showcase that in their own journeys, but also in their communities they have around them as well, professionally.
Nice. Any siblings?
Got 3.
Oh, sister. Well, you had one sister for sure. Okay.
Yeah, I got 3 older sisters. Do different things. So the oldest one has been an elementary school teacher at Houston, Texas for about 15 years. Teaching during the pandemic, which is hearing that firsthand was a whole different world. Before that, she was a social worker, first person in our family to have an advanced degree.
Okay.
And all of us kind of followed her. Middle sister, she actually works for what's called the Acting Fund, which is the philanthropic arm of SAG. So most recently, as a lot of the writer strike that was happening, it was her organization that actually dispersed out funds for actors to kind of meet their rent, pay for their insurance policies and premiums. So she does a lot of work with actors from the 60s, 70s, 80s, and 90s, and helping them to reinvest back into this union, which is what it is.
Interesting.
And then my third sister, she's a faculty member at UC Berkeley, teaching a lot of courses on women's violence prevention, women's safety, inclusionary services around really ensuring that the term you may hear is terminal degrees. So think MD, JD, PhD students who are about to leave the university are creating environments to really be supportive for as much, anyone as possible. And I think what's unique about that is also a former social worker, did a lot of work in recidivism in primarily the Midwest, and has taken that work to the West Coast and really done a lot more opportunity around faculty training, student training, and graduate school training. So they all have big hearts. They all, give back, do a lot of public sector work, and they've just been a pillar for me to learn more about how to be a better executive and better version of myself.
That's great. Your parents must be super proud. They obviously raised some awesome kids, and that's great. Congratulations to them. Any let's see, any how about you? Any kids, married, single, social life? What's the status for
That's
Cameron?
funny. When you say social life, I definitely don't have one. So me and my partner, girlfriend, we have a 2-year-old Sebastian here with us, keeps us busy.
Okay.
It's funny in the standpoint where he was born in October. We started the business in December, so he's as old as the company is. So it's always like a
All right.
unique reflection, if you will. Yeah, partner's name's Etika. She has executive communications for Amazon. So if you ever read about AI or generative AI from Amazon, comes through her team.
Okay.
And then our youngest, our only child, Sebastian, he's 2, so he's not here. Otherwise, you hear him in the background yelling or on something. So he's at daycare.
How'd you meet your girlfriend?
Great question. So we first met in a pre-MBA program. We're
All right.
both going to our business school. At the time, she's working for Senator Castro in housing and urban development. So she worked in the Obama administration. I worked at a startup technology company in DC, and then started as friends and eventually just stopped becoming friends. But neither of us went to business school. So we did all the work, did all the applications, did everything else. I ended up leaving to go to another startup, and then she ended up going to a global PR fund or firm. And we just had the careers we wanted without having to go back to school. And we joke about it because I run a business, she runs a pretty significant P&L, and it's one where folks are like, so what business school did you go to? And we're like, her background's in like English, my background's in physiology, and it just kind of worked out this way.
Very cool, man. Good. I appreciate you sharing all of that with me. Thank you very much. Thanks for getting personal. You didn't share it. Was there anything before we get into professional life though? Were you always just a good kid, ran track, made straight A's? I mean, were you always like, straight and narrow? Was there any rebel in there at all? Did you ever, venture off into the dark side and get in trouble and have to call dad or anything? Nothing.
No, so my dad's the third youngest of 13. My
Ooh,
mom's the oldest of 5. I'm the youngest of all of them, and I have a bunch of older cousins and siblings and aunts. And I learned through lived experiences and theirs of the consequences of life. And
okay.
I think early in my career, I guess as a younger individual, it's like, hey, listen, like you're pretty athletic. Everyone says the reason why folks don't kind of get out of, Compton, California is because of grades. So I never took those lightly. I've always was one where I'm like, I don't want to be we call them SAT stories, where someone's a 5-star recruit, they've got 80 offers, they can't pass the SAT.
I see.
And the story that, just kind of sat on me even as a young child, because you see these, individuals on Saturdays, you see people on during the week, at basketball games, like, man, I can't let that happen to me. So I think those are sort of the things that really kind of help me stay grounded. I mean, like Compton, California, from an athletic perspective, I remember being, 8 or 9 years old and seeing Tyson Chandler play basketball. And then the next year he's playing for the Chicago Bulls. Right. Or, seeing guys like Richard Sherman, who I grew up with, great track and field athlete, goes to Stanford because he has a 4.4 GPA, right?
Yeah.
Plays football. So you have these otherworldly opportunities, but for folks being like, listen, it seems unlikely for it to happen to you because you may not have thought of it for yourself. So once you sort of manifest that, the distractions that come with everything else, street life, gang life, I don't know, different sort of opportunities that can really derail you, were always things I was aware of, and just had sort of the self-discipline to sort of circumvent them, but also had the use cases of family members saying, listen, let's think differently about how you approach this. Even when I came to college, it was one where those same, relationships helped me to stay locked in, stay really disciplined, but no late night calls, nothing sort of in that realm. And I've been a pretty, I don't know, a straight narrow guy my whole life.
As a recruiter, anytime I see somebody that we're trying to recruit, a candidate we're looking at, if they played college sports of any kind, whatever level, even Division III, like, I don't care, right? If they spent 4 years as an athlete in college and they kind of worked part-time, they were on a team of some for 4 years, and they got through school, I always highly covet those candidates because it means they're coachable. They have great teamwork. They have great work ethic. They're highly disciplined. They're highly organized. You don't play 4 years of college athletics unless you got your shit together.
100%. Oh yeah, it's I completely echo that, and I think it's one where it's a unique hack on the recruiter side to actually pay attention to that. And I think for folks who don't, it's just a lost opportunity.
Yeah. Yep. Totally. And I love the fact that you have some of that on your LinkedIn profile, by the way. Some people don't. Every once in a while, I'll talk to a candidate and they'll be like, "Oh yeah, I went to Cornell and I played lacrosse. Played on the lacrosse team for 4 years at Cornell." And I'm like, "Well, how come that's not on your LinkedIn?" Like, "Oh, should I put it on there?" Yes, you should put it on there.
People know your background. People aren't always going to Google you and know you were a stud or whatever the case, or even just you participated. So I've always been mindful of keeping it as I came from the academic realm before I moved into sort of like the for-profit space, and we call them CVs, which is like you put everything on there.
Yeah,
Every time you
totally.
presented something, every time you taught a class, your CV may be 15 pages. So that's not obviously appropriate every time you want to submit a resume on, for a job today, but your LinkedIn can kind of be your your repository of accomplishments. And it's important because, I'll have conversations with folks who are like, "Well, you did track?" I did field. They're like, "Oh, what events did you do?" And you have to tell them about the hammer and the discus. They're like, "Wait, what did you do? What is that thing?" And it can create a much more organic, familiar conversation versus always just being transactional with folks only talking about
Exactly.
the last job you had.
Exactly.
Yeah.
Little EQ, little emotional intelligence. You must be a big guy. Are you pretty? You must be good size.
Yeah, 6'4", 250 today, and then when I was showing,
yeah, you're a big dude.
300.
6'4", 250. If we go to the bar together, I want you on my side. I'll be like, yeah, I'm with him.
People don't realize how I don't know, big I am, especially because everything's on Zoom until they meet me, especially during the pandemic. And you kind of stand up and someone was like, "You stood up and you just kept unfolding." And I was like, "Yeah, I'm not 5, I'm not 5'6". They're just like, also, I forget it because in my head, all I see is my vision.
Right.
And then I also have friends who, they're 6'8", 6'9", former athletes of some sort. So I'm like, "I'm not that big." And they're like, "You are. You should appreciate."
You're big. Yeah,
so,
6'4", 250. Yeah, you're a good size.
yeah, it helps. I mean, especially doing home modifications and improvements stuff. We'll get to that later on, but it helped in that scenario. But you realize there's a skill set that was missing. But size wise, decent size individual.
Was your dad a big dude too? Good size?
Yeah, my dad's 6'2". My mom, she's 5'8", 5'9". So I think it kind of resonates. My sisters, however, are not tall. I mean, I think the tallest one maybe 5'8", but the other ones are 5'3", 5'4". So it worked out. Baby of the family gets a little bit more of the height and athleticism, and you didn't want to waste it. I'll just say that as I tell my family, I just didn't want to waste it. I don't want to be a person who's like this size. I'm like, "You play sports?" You're like, "No, I was an accountant only." You're like, "What?"
So talk to me when you're going to school. How'd you end up getting your master's on the East Coast? Were you out there for a job or something? But anyway, I guess that's a two-part question. How'd you end up going on the East Coast to get your master's? And then what was your plan? What did you want to be when you grew up?
Yeah, it's interesting. Few folks really make that connection or even ask that question. So there was a commercial that came on when I was in college, and it was basically every college athlete doesn't become a professional athlete type of a narrative, and it was go get your degree type of a thing. So after my sophomore year, I came back to school, and that summer I had a terrible summer job. I was to my size, I was a security guard at a mall. So I was a mall cop. Same year that Paul Blart came out. So everyone was like, "Oh, you're gonna just ride segways all day long." But I did it because after work I worked out. So that was my whole vision. And I took a class at Colorado State with a guy by the name of Dr. Matt Hickey, called Exercise Physiology. And it was the first class I'd ever taken where I was like, I really want to know everything about this class. Right? Much like the same intuition you would have when you do a sport. You're like, I got to learn more about the history of this. who's currently great, all the nuances. I just want to get better at this sport. I was like, I want to get better at this class. Because it was the first time I was able to actually understand intuitively what was happening, but also what was, I was like, there's a whole other mountaintop of information over here on exercise physiology of what happens when someone's training at 7,000 feet at the University of Wyoming, they go compete at San Diego University at zero sea level. I get that. Now I understand why that happens underneath the skin. But then it was like, what does it really mean to have diabetes? What does it really mean to have cancer? What does it really mean to have the system of the body? I was like, I love this. I got to learn more. And he was like, we need to do an internship in a laboratory. And I said, okay, well, what does any of those things mean? I don't have a CV. I don't have a resume. All I could do is throw things really far. They're really heavy. And he was like, okay. So fast forward to, the next semester, I ended up getting an internship at the University of Iowa Medical School. So I went to Iowa. And I studied diet-induced obesity in rats. And it was the first time I was able to understand sort of the lived experience and what folks now call social determinants of health and the impact it has on not just your physical health in the standpoint of like, do you get fat, do you get larger, there's fat deposits, but also what does it mean to your nervous system, right? Because one of the first indications of impact from diet-induced obesity is what's called glycolytic neuropathy, which means that sugar binds to your neurons, slows down the conduction of electricity, and you actually can't move your leg. One of the top reasons why you have amputation in America after car accidents is diabetes, right? So you're now putting classwork, homework into this context of like research. The next year after that, I went to University of Oregon, and studied what are called basically shoulder pathologies. So if you were to hold your arms out like this, kind of like in an abducted motion for a long time, right, your shoulders start to deteriorate. And you would say, well, that makes a lot of sense. Like, but who does that? Mason workers, contractors, but the group that has the highest amount of disability claims is actually dental hygienists.
Interesting. Wow. Okay. I can see that.
I could start to make these connections, and I'm like, I got to learn more about the human body.
All right.
And so when I was about to graduate, the top school in the country for kinesiology or the study of movement is University of Massachusetts-Amherst.
Oh, okay.
And at UMass Amherst, they had about 5 professors that basically ran their industry. The first person was a woman by the name of Patty Friedson. She invented the Friedson cut points. It tells all of us, and technology-wise, for walking, running, or sitting, right? And your smartphone and your pedometer or whatever, like that is her mathematical equation. Another woman, Priscilla Clarkson, invented muscle physiology fatigue. So when we think about like, what do I eat after I work out? You can thank her.
Okay.
Joe Hamill, one of the top footwear biomechanists in the world. So some of the top chief science officers at Adidas, Brooks, Nike, all came out of his lab. And then the guy that I worked for by the name of Barry Braun, who's actually at Colorado State now, one of the top exercise and diabetes scientists in the entire world. I was like, I got to work.
Cool. Yeah.
And applied on a whim. So in the fall of my senior year, had all this great research, met one of his alumni. We talked at a conference, and she was like, listen, I'll talk to Barry for you. Let's see what happens. And I've been emailing Barry for like a year. No response. Nothing. Like, no, whatever. Conference gets over. Barry's like, I'm interested. Like, however, it's November. He's like, we got to make a decision by January. Can you come out here, in a couple of weeks? I'll come out there next week. I don't give a damn. So flew out to Hartford, drove up to Amherst, and over 3 days met every single one of the professors there. And I was like, what I want to be is the best professor in the world. Nice. That's the intersection of healthcare disparities and the clinical impact of them.
Very good.
I ended up going to Massachusetts, graduated in June, was moving in August, and it was a great 2 years and great opportunity. Then I coached track when I was at UMass. So I actually coached the throwers at UMass-Amherst, set a couple school records, internationals, and
wow.
Let the bug go a bit.
And you were going to go on and get your doctorate? Were you going to get your PhD? Because I see something. What was that? Tell me.
Yeah. So I ended up starting my PhD at the University of Michigan. And we actually built the country's first childhood disparities research laboratory, studying the impact of first the Flint water crisis, what happened after that, but also studying the impact of Detroit after it filed for bankruptcy and started closing hospital systems, care providers, in communities of color. So what happens when you start to lose access to care? What happens when the built environment, the neighborhood environment, like in Flint, fails you and fails your health? But if no one's quantifying the impact of it, that's what we were planning on doing. And so started a PhD there, was teaching, taught at UMass, taught at Colorado State. Was 24-year-old PhD student. Nice. And I just remember being one of the class I taught had about 200 students in it. I'm like, man, what am I doing? Like, not like my whole life ahead of me type of thing, but I'm like, damn, this is interesting. And at the same time, the healthcare reform went into law. So the ACA went into law, and this notion around value-based care came into place, which means that we're not going to pay on services, we're going to pay on outcomes. Okay. And what I was able to understand was the existing infrastructure on what you would do, how you would intervene in someone's health, needed to incorporate a lot of components outside the four walls of the hospital. You have to realize where someone has access to transportation. Do they have access to food? Do they have access to the living and conditions they should really have? Because I'm coming from academia. I'm coming from an MBA. And to me, it was, well, there's all these decades of research, but no one's out there advocating for lower income households. No one's really advocating for communities of color, as an example, to really get the best, most innovative payment methodology for physicians to serve them in the correct way. People are still just getting random services, and it's not improving the outcomes. So had the change of heart and went in and talked to the group at University of Michigan and said, I'm going to take this job at this startup down the street called Truven, who's doing this for employees. They're going to work with these Fortune 500 companies. They're going to create these really unique benefits. They're going to save money, improve health outcomes. I want to do it for at least a year and take a leave of absence, and I'll probably come back.
Hey, can I ask you real quick now, just for the listeners, how big was the startup? Was the startup like 3-4 founders, 2-3 guys? Did they have angel money? Like what kind of, where were they at in the timeline, the lifeline?
Yeah. So it was a private equity backed company. So they had basically a conglomerate of like smaller companies that became one.
Okay.
And
so they were down the road a little ways.
Okay. Down the road a little ways. If I had to give a sort of a series, probably a series D or so. But
okay. All right.
Yeah. They ended up getting acquired by IBM 18 months later, though. And that's when I got the bug of like, I think I can do this. And as an early stage company for them, it was just trying to, they were pivoting. I think a couple of the companies had already gone bankrupt, and they just like bought the assets, if you will. And the way Truven was set up was you had businesses doing their own thing. Like this group is focused on Medicaid. This group is working on small business groups, like building benefits for them. But I remember my first day I started, like, yeah, we already have existing contracts. We just can't monetize them. I said, well, who do I get to work with? Because I'm thinking it's going to be, the fancy this. They're like, no, it's going to be a group called Rock 10. They're the largest paper distributor out of the country. I'm like, what? Okay. And it was Eli Lilly had to go up to Indiana for a few times. And then they were like, yeah, but there's this vertical called emerging companies, which are these small technology companies that could be big one day. I don't know. This is my boss telling me this. But they needed innovative benefits to reduce their total cost of care, as well as to improve workforce, presenteeism. I'm like, all right, cool. Like, I want to do that. They're like, all right, here's a bunch of companies, whatever. Those companies end up being Pinterest, Netflix, and a company Sling. And we're talking 2014, 13.
Right. Yeah.
So like, they're big now, but at the time, you walk in, you see everything.
Yeah. That experience with Truven and then them being purchased by IBM, that was a pivot point. That was a moment that kind of implanted the entrepreneurial bug, right? Probably forever, somewhere in there.
I would say subconsciously, because I didn't ever think about being an entrepreneur. I really thought about being an operator. I love your hands up, but it was that's where it probably first started. You're right about that.
Okay. And then you went on. You had a couple of more stays. You had a couple of more jobs, so to speak. You were at Bright Health for almost 4 years. What were you thinking? And then DaVita for
Mhm.
what, 2 years.
Mhm.
What were you at that time? Were you thinking career-wise? What were you thinking? I want to be a VP. I want to be an executive. I want to be a COO. Like, what was going through your head at that point?
So when I was at Bright Health, the narrative was, that was the job I took instead of going to business school. So
Okay.
I said, you know what? I could be an executive in time. I could, directionally that made a lot of sense. But I think to me, it was never really still being an entrepreneur. There weren't a lot of Black entrepreneurs in healthcare. There was Bernard Tyson, who since recently passed away, the former CEO of Kaiser. But like, I didn't think it was me. I didn't come from a fancy background. I didn't have an Ivy League degree. I was like, they'll never pick me type of a thing. So I just wanted to learn as much as I could.
All right.
But at Bright, the CEO was a guy by the name of Bob Sheehy, who was the former CEO of United Health Group, so ran the full mothership, like the full United.
Okay.
And we used to get lunch once a month.
Good.
And over 4 years, up into the
Good.
pandemic, that went from like, why the hell does he want to meet with me, to like, I could probably start a company. Right. And it was like, you have this dialogue where, his whole thing was like, you just got to figure it out. And he told me his story and I knew it, knew his family, knew my family, everything else. But you kind of realize when you walk back in the room, the deference that people have. But you went to lunch with Bob? And you're like, yeah, we always get soup and, we talk about whatever. And,
Great move. Great move.
And I always tell people, it wasn't something I sought after. It was one day Bob sent me an email like, hey, would you want to get lunch? And I remember,
Yes, I do.
That at that time, I was frustrated. I didn't want to be at Bright anymore. I was like, I don't want to do this.
Oh, really? Oh,
yeah. And it was timing, it's God's timing, right? So over the weekend, I'm sitting there talking to my parents and just being like, I'm going to leave. Minneapolis isn't for me. I can go get a gig here. And they're like, man, just give it a couple of weeks. That Tuesday, he's like, you want to get lunch tomorrow? And I'm like, okay. In this meeting, do I tell Bob and vent to him about the startup not working? It's like Series F. And my dad was like, no, just go listen. Just go listen.
Good move. Good advice.
And that started like a 6-7 year relationship. And
that's awesome.
What happened at Bright, specifically, this gets to a little bit more about Rosarium, is that I was overseeing what's called supplemental benefits. So that's your dental, your vision, your hearing, your telemedicine, right? And this is from scratch. So we had, a handful of members, and you're like, they need dental benefits, but then they call you, this dentist is terrible. Or my ride didn't come pick me up and I'm in Jacksonville, Florida, right? Just all the different sort of like case studies. But over the 4 years, we grew from about 10,000 lives originally just in Denver to just over 800,000 lives in 14 states. And to be able to have this growth and this experience, it's like, opportunity, plus having someone like Bob in the corner being like, Zig instead of Zag, or when we were managing 2 million people in Dallas, we tried this thing, and you got your PhD in healthcare because you're also a health insurance company. So you're paying for all the service. You saw the real bills, you saw the real costs of everything, and you went through a pandemic. Right. And you go through all these iterations of just, a business, and you don't realize the lessons you're learning in real time. So when I went to DaVita, it was with the mindset of, I'm going to go become an entrepreneur.
Oh, okay.
But I don't know how to do executive sales.
All right.
And if I think about being a founder, one of the key things I see a lot of founders miss on, and I had started working with startups at the time as well as a mentor, just on the health insurance side.
Okay, good move.
Founder-led sales. They get in a meeting and they fold, right? I'm like, if you're in a meeting with Blue Cross of Kansas City, it's your company, it's your startup. You can't have, Mary or John speak for you. You're just like, aimlessly silent on the phone. It's weird. And the small things are what wins deals, is what we say at DaVita. But the small things could be, okay, if you're going to do a deal in Alabama or Mississippi, the conversation has to happen over food.
Yep, probably. I would see that. Yep.
Right? Yep. But when you go to a place like California or somewhere on the coast, right, you should be mindful of parking. How does someone get there? And all those little nuances were sort of like be in the back of my mind, wrote like just a long CVS receipt of insights of like, when I go start my company, I'm gonna know all these things. I'm gonna know every little thing possible, and that's
good for you.
Was a big tailwind for me once I made the jump.
And when you're thinking about starting a company, what did you have in mind? Did you at that point where you're like, I don't know what I'm going to do yet, but I'm going to start something, or you had something in mind?
I had Rosarium in mind. So
Okay.
I knew what this was. Like the genesis of the company started when I was at Bright Health. So we had, right before the pandemic, actually, in-home falls are a huge cost driver to our P&L. So when someone has a fall in their home, it probably costs the health fund about $14,000 to $15,000 per person. And that's,
Interesting.
avoidable ambulance ride, ER visit, night or two in the hospital system, then we get transferred to a skilled nurse facility.
All right.
And you can see the entire claim. You can see the entire bill. Now the member may only see that and say, oh, it's $2,000. I'm paying 20. But if I'm in New York, I'm paying 30. If I'm in LA, I'm paying 35.
Okay.
So in my head, I was, okay, well, I know this home modification benefit is covered for all veterans in America and their spouses. I know it's covered on Medicaid. Let me use this benefit. The challenge was no one could do it at scale. I could find a contractor, but if I had 80,000 members in a city, no one company can service all those individuals. So I was like, that's fine. Let's build a network. Let's do this. So once the pandemic hit and we had to move our attention to telemedicine, which was like the core thing at the time, I was able to also see the data that said this is not a need just in the one market I'm focusing on, which is LA. It's a need in all 14 states. Rural Nebraska, people in like York, Nebraska be like, I had a fall, what do I do? I had people in Greensville, South Carolina saying the same thing. And I'm like, damn, this is a real need. When I got to DaVita, it became a bigger need when someone says, hey, I want to do in-home dialysis. Because if you do in-center dialysis, as an example, you got to quit your job. It's 3 days a week, 4 hours a day, doing dialysis. But when someone says you can do nocturnal dialysis in your home and not quit your job, you're like, well, I want to do that option.
Sure.
If your home is inaccessible, you can't do that option. They can't get the equipment into your home. They can't get the caregiver into the home.
I see.
You're seeing this in real time. I'm doing this is in the back of my mind of doing home mods. I'm like, damn. I'm thinking it's just a senior fall thing. I didn't even think about dialysis in the home, chemotherapy in the home, home health in the home, hospital at home. I'm not even thinking about these broad use cases. So I'm sitting there having success at DaVita, and I'm like, man, all I want to do is get, not a grab bar. I want to remodel a bathroom. I want to get an elevator into someone's home because when I go back to my time at my PhD, I'm like, the built environment is the hardest part of healthcare to solve because healthcare practitioners are consumers in the housing environment. They're not experts, right? A neurologist has no real idea how to do, a floor modification to ensure someone can transfer with their will. That's just not their skill set. They can refer it,
right?
But he or she or they aren't really going to be out there like popping up, luxury vinyl, tiles, or the opposite. You have a contractor who's like, I don't know how to get paid by Medicaid. I don't have an MPI number. I don't know anything about value-based care. I can just, you start to see this hyper fragmentation, but then you also have the question of, this goes back to my time at DaVita, I was like, this is why I should really leave, is you have about $300 billion that's about to come into the home. $300 billion of care. So, you have payers and we're going to do more care in the home. You've got United purchasing companies for $5-6 billion. But if 2% of housing in America is accessible, what happens? Right?
Is that what it is? Is that the number 2%? Wow.
2% of housing units in America.
Can you define for the listeners accessible? What's the definition of that?
Great question. So accessible house is every doorway and entryway in your home is at least 36 inches wide. That's one. Two, there's no level change between any room in the home. So there's no sunken den. There's no steps to the to your front door. There's no steps into the garage or even to the back patio. And then the last is, do you have a full bedroom and a full bathroom on your main floor?
I see. And those modifications are paid by Medicaid? I didn't know that.
Oh man, there's a bunch of funding sources for it. So
I did not know that. Didn't know that. Then why isn't everybody over 85 having modifications done right now in their home? Why aren't there?
I get excited because the answer is it's happening, but it's not happening in the way you would think. So I'll put it in two stories at the same time. So the 1930s, you have the Great Depression. 30 years later, those people are aging. While at the same time, we're also at a war in the War of Vietnam. Yeah. So you had a bunch of public services come on to bear. So 1968, you have Medicare. 1969, you have Medicaid that becomes funded. Okay. 3 years before, they had what's called the Older Adults Act of America of 1965, which puts these senior units called area agencies on aging around the country. that says we'll help these seniors get services. The one service people primarily know is Meals on Wheels, right? But home modifications were actually in that same act.
Didn't know that.
That act is based on the GI Bill of the 1940s.
So
when veterans came back from World War II, had permanent disability, needed modifications while they're having urban withdrawal. That's how it first got started. However, it's a very private conversation. It's a very private conversation. Folks aren't talking about their wheelchair, and folks aren't talking about their bathroom modifications. It's happening in a very small, realm. Fast forward 100 years, or 80 years, wherever it is now, homeowners 65 years and over are actually spending the most amount of money on home improvement projects in America. Just that category.
My own mother is 80. Mm-hmm. They just redid their bathroom specifically so that it didn't have, it was like a walk-in shower with no lip or no step or whatever. And then it had the seat where she could sit down. Like they specifically had it remodeled for her age and how she gets around. Are you telling me that could have been covered by insurance?
Or state municipalities? There's a bunch of funding sources for it.
I bet she didn't know that. I bet she had no idea. They just paid for it. I bet she had no idea.
We've been on calls with health plans who didn't even know they could cover it.
Wow.
That's how much of a gap we're talking about in knowledge. Not just,
totally.
Your mom or my mom or family members, their health plans who were like, wait, this is, because not just Medicaid, Medicare Advantage Part C, private insurance now covers it. And they didn't even know they had the benefit because it's as new as 2 years ago. So we're probably talking about eligible population for about 72, 73 million people today. We're talking about adults because this also applies to children. So money's there.
Not to mention all the trade skill workers that you could put to work for jobs to do all these modifications. You're creating a shit ton of jobs to do all this work.
Oh yeah. I mean, it's one where, Rosarium Health, we start as a managed marketplace, feels like Angie's List for healthcare. And people are like, well, what's different then? And I said, it's on the demand side. We have clinicians that can go in the home and do the home safety assessments to make sure it's clinically oriented on what the modifications may be, right? That's all great. Contractors on the product, they can come in and install the work. That demand side though, we do have homeowners and renters. We also have Airbnb hosts. We also have firefighter departments. One of the top reasons for firefighter dispatches are actually in-home falls, not fires anymore.
Oh, I believe that. I totally believe that. Yep.
Huge cost to taxpayers in a given city. There's some cities that say, on average, you're seeing between 300 and 500 calls a month for in-home falls.
Yeah. Mm-hmm.
So you have fire departments on there. You have home health providers on there. We're currently in the Texas Medical Center Accelerator, which is the largest medical city in the world. Some of the largest hospitals in the world saying, hey, we need help with this because 30-day readmission rates are a huge cost driver to our business. We need someone to come in and do the work, immediately. Or can they do the work while the person's still in the hospital system? We'll pay for it.
There you go. Yeah.
Right. You have veteran-focused home health providers like, we'll pay for this because the veteran already has the benefit. So we see ourselves sort of in a two-pronged approach, which is Rosarium Health does facilitate the home modifications, but we want to connect these households to the highest quality service provider as soon as possible and get that person paid. And when you look at the Older Adult Act, to go back to these area agencies on aging, the AAAs as we call them, takes about 9 to 14 months for them to do a modification in your home.
All right.
If you do Medicaid, it's about 5 to 6 months.
Is that because of the approval process and filling out the paperwork to get it scheduled? I mean, I know the construction work itself takes time, but is there a bunch of red tape in the beginning?
Bunch of red tape. And one of the biggest red tapes is that you need a clinician to come assess the home first. Okay. And at least 3 bids per project. And
I see. Okay.
Right. And you have, Janet's making calls and she's like, I got, a bunch of work to do. So for us, we're able to do modifications in less than a month. And that's from when I need this done to being done is less than a month. And we go out and build these networks of tradesmen, clinicians, then we go find the demand. So we reduce their cost of sales. They don't have to market as much. We give them a better pathway into diversified demand through these, different, demand, engagement. Plus there's a pathway into health insurance through a supplemental benefit, which that was my background at Bright Health. So I'm like, I know exactly what I need from you as a health plan. Don't worry.
So it's not the health insurance companies drag this. They're not the ones causing the drag here.
It's no one's real fault is probably the best way to answer that question. It's just a lack of awareness. And I
Okay.
And my prime example I can give you is in Arizona. Another, we're both in Colorado. In Arizona, there's a thing called the Arizona Caregiver Coalition.
All right.
And they have a rebate program that will reimburse you up to $1,000 for your home modifications. All you need to do is fill out the paperwork, find a contractor, just keep the receipts.
Okay.
We talked to the AAA, or excuse me, the AARP of Arizona, and she said, Cameron, we earmarked $3.5 million for this last year. We only spent $104,000.
People don't know. People don't know.
You don't know. And
wow.
You look at a place like in Minnesota, they have what's called an elderly waiver. If you are 55 years and older, not even 80, but 55 years and older, and you qualify for nursing home level care, but you don't want to go to nursing home, the state will actually grant you between $20,000 and $40,000 per year in perpetuity to modify your home.
Okay, well, I know for sure nobody wants to go to a nursing home. Nobody.
No one wants to go, and they can't really afford it because some are like $8,000 a month. So it's like,
yeah,
you have these nursing home diversion programs that are just sitting there. And for us, at first, it was really educating the supply side, educating contractors. Like, they don't want me. And I'm like, they literally look at page 7. Do you have this qualification? Like, I do. I'm like, yeah, we want to work with you and we want you on our product. And we want to make sure you get access to demand because it'll be different. Just give us a few months.
I'm thinking that, just listening to you tell this, if the consumer, if my mom starts yelling enough, if you get enough people like my mom saying, hey, I want to do this and I want this paid for, that's your key, isn't it? Because the insurance companies aren't going to wave the flag. It's got to be the consumer raising the flag saying, I need this ramp on the front of my house, or I need this bathtub, this new shower, or whatever.
Yeah, it's our challenge right now as a business is just consumer demand and getting them prepared and getting them ready, because folks will say, because Rosarium Health right now is a managed marketplace, and then we have a managed service organization. The MSO, managed service organization, is what we'll sell to health insurance companies. That's all fine. Today, for consumers, we have this marketplace because you may want a general contractor, but if you need an elevator into your home, your cousin can't do it.
No.
And
no, you have no idea who to call. Yeah, totally. Okay. Yeah. By the way, for the listeners, I want to, let's get this in here. So it's rosariumhealth.com, rosariumhealth.com. Who should be contacting you? Who should be going to the website? People like my mom or the contractors, both? Who should be reaching out?
The answer is both. And we will start with the service providers and the contractors. And the reason being is that what we do on Rosarium is you try to create a diversified demand channel for them. And what I mean by that is what's critical for us is not just about having, great contractors. It's about having diversity of contractors. It's the same way I would think about if I'm building a medical network. I need PCPs. Okay. I need specialists.
Yep.
And it's because there's times where I'm going to need both of you for the same job.
Sure.
And you have some states now covering things like asthma remediation. So you have HVAC providers who now can get reimbursed for installing, humidifiers, removing mold, right? And
how about that? Yeah.
Our goal is like, we need to work with you first so you are prepared for what is on the other side of this fence. So that's us. We're confident about that. We want more contractors. We want more, even apprentices that they're getting started and more clinicians. Okay. And then we need more demand, as well, because we see a lot of people who are like, well, I already did this. And I'm like, well, did you pay for it? They're like, I'm like, well, okay. We can't do anything about that now, but like in the future, we can definitely help you with it. And we always tell people, you want a clinician in the home first, because now this intervention becomes a medically necessary event. And even if you use, the Jobs Tax Act of 2018, it's a standard deduction. And, when you do your tax, if you do a medically necessary home modification.
Clinician, I mean, wouldn't it be awesome to just have a clinician that knocked on the door of every 70-year-old and up and just said, hey, look, this costs you nothing. If I do a tour of your house, I can tell you what you qualify for. And by the way, if you do qualify for some stuff, I can connect you with all the right people to get this stuff done. Boom.
And for us, it's been a one-stop solution for folks, because it's, you take that as an example, which you want to make sure we're doing, and let people know, hey, listen, like right now it's November, at this time period. We're trying to rush to get people to exhaust their benefits before the end of the year, because they're like, listen,
yeah, of
they're
course.
not going to re-up. They're not going to stack either. They're going to be gone.
Can a consumer go to your website, contact you to schedule a clinician to come to their home?
Yes. So right now we're available in Texas and Arizona, but we tell people we have a national reach. So we're doing a modification right now in rural Arkansas. So even one-off examples, we tell them, go to our site, create an account. It's free to you. We're not going to charge you as a consumer. Send out as many leads as you need, right? Because it's important that you get the range of people there, and then we'll build you a micro network around it. It takes us about 7 to 10 days to build a network in a community, even less if it's a major city. Like just most recently, we had it'll be public in a couple of months, but we're working with a veterans organization that just purchased an apartment complex. And they're using our product to not only assess all the units in the complex, but to modify them to actually house senior homeless veterans.
Can the clinicians do this remotely with the homeowner using a camera to just do that, or do they have to visit?
They don't have to visit. We do virtual assessments. Some people are comfortable with that.
All right.
We do a lot of that for rural
yeah, for sure,
as well.
I would think so. And are these all, how do you make money? What's the business model, Cameron?
So we make money by monetizing the supply side. So we charge a fixed monthly subscription fee to the clinicians and the trades workers to be on our product, and they pay for a shared lead thereafter. And these are all fixed price. So we don't, unlike some of our substitutes where it's 10% of whatever the cost of the project is, for us, it's a fixed fee. It's about $100 per lead. But when you're looking at a modification, it's, let's say, as low as $500, it's a 5x ROI to us, because we don't do a take rate of the project.
Okay.
So,
all right. And who do the clinicians work for?
They're all independent. So these are independent clinicians of their own business, independent home remodeling companies. So they don't have a Rosarium Health polo. They're not jaded by our opinion. Like, you're getting the best of the best in your community, who, for instance, a lot of the contractors may come from workers' comp work. They may come from special needs work at, or ADA work at a commercial real estate.
Okay.
So we have someone who's like, I've done all the accessible bathrooms at the Hilton down the street, so I don't have to do this one person's home.
Okay.
You're bringing in, a really great, resource immediately.
Okay. All right. And then I know we're over on time, but I got a couple more questions for you, if you don't mind, just real quick. Are you in a cash raise? How much cash have you raised? And are you in another raise right now, or what can you mention?
So we raised $1.7 million for our pre-seed round in Q2 of 2023.
Congratulations. Congrats.
Thank you. It was led by Rock Health Capital out of San Francisco, co-led by Rock Health Capital out of San Francisco, and Primetime Partners in New York. We expect to raise again in 2024, 2025.
Okay.
That raise will be our first priced round. Okay. And that raise will really help us to actually take that marketplace product and scale it into about 5 to maybe 10 states, and then also be used to capitalize the business to support health plan partnerships for a 2024 launch or 2025 launch.
Are you in the lifeline of your cash flow? Are you still burning cash, or are you having enough revenue to sustain right now? Or you're in growth burn phase still?
Growth burn phase.
Yeah,
so
okay.
We use the marketplace less of trying to get to profitability and more of as a proof case, because to us, even work with an insurance company, which is our sort of like, that is our North Star, which allows us to get to the right distribution. It isn't about, can you service these McMansions? It's like, can you service these, mobile homes? Can you service these, condos?
Yes, for sure.
Types of housing is the goal. And then it's the types of modifications in that housing. So
the mansions already have the modifications. They don't need help.
100%. You're absolutely right. Yeah, you go walk into some, they're like, you want a grab bar in this 9,000 square foot home? Like, I mean, you're kind of fine. Like, I mean, we'll get it, but also like, you're fine.
Very good. Okay, and how big big as an employees? Are you ramping up? Do you have a few? Where are you at in the life cycle of your team?
Including myself, we have 10 total.
Right.
And then over the next, I would say 4 to 6 months, we expect to increase that to probably close to 20. And
Nice.
that has a lot to do with the raise, but also has a lot to do with staffing against some of these, we call them special projects, some of these bigger projects of the apartment complex or these payer deals. And that's another piece about how we think about staffing the team. So it's split between consumer technologists and folks who have deep healthcare backgrounds.
Okay.
So you get some interesting conversations, internally.
Are you paying yourself yet, or are you paying yourself peanuts? What are you doing?
It's peanuts. Yeah, it's luckily we got stuff taken together. Erica's doing great. But it's definitely
yeah. Is Erica like, is she like, honey, look, I know you're having fun with this, but when are you gonna start making money?
She does it in a unique way, which is like, so when is that next raise coming? How's that how you think about that? And it's funny because you're sitting there, you're like, I would ask the same question too. Like, first it was like a little napkin thing, but like when I was at DaVita, everything was like flying or whatever. Now it's like, listen, 12 to 18 months. She was like, all right, it's 6. So when we but I love her to death, and she gives me a hard time. But yeah, it's to me, I look at it as a leader eats last. So I make sure my team has the right salary, make sure my team has the right equity, and also the right thing to do. Because then that's also the thing that we've learned is, listen, this is not a sexy startup. There's no real AI in our business. We're not chasing the newest trends. Like, we call it blue collar innovation. And
but hey, listen, I think that's awesome. I think trade skills and anything like that is that's where to be right now. Those guys, the industry that you're in, to connect trade skills with this need from the consumer, with something that's available that they don't know about. I mean, it's brilliant. And I think trade skills right now are gold. Hey, the laptop workers and the software engineers, those guys are in danger from an AI perspective. The electricians, the plumbers, the welders, these guys are in super high demand and will be even in more high demand. Sorry, I'm going off on a rant.
No, you're right. And it's what we tell them, which is, hey, listen, I know it doesn't sound like it, but like, it's something like, listen, we're starting this market, give us some time. Like, there's no demand here. I've done the Facebook ads. Like, no. Just give me a few weeks. So then a few weeks come by, like, what the? I got to leave from the fire department. They're like, yeah. They're like, is this real? You're like, it's hidden. But just do your thing. They're like, well, Cameron, I don't know how to really support someone who has, a traumatic brain injury. I'm like, you had a clinician that told you these are the right modifications for them. Just do the modifications. I was like, just like a orthopedic surgeon doesn't understand all the things about pharmacy.
Right.
I don't need you to understand all the different things about every little thing here. Just be the best version of yourself. And the reason why we have such confidence you can do it is that there's no take rate here. I just want you to get all the capital, because we're going is, and this is the cool part about these tradesmen, I'm like, imagine the day where you can say I've reduced readmissions with my modifications.
Man.
Like, imagine that bullet point on your what? Like, wait, what? I'm like, yeah, readmissions is one thing. Think about how many days this person doesn't have to go to a skilled nursing facility, or this person didn't have to sell their home to go to a nursing home.
Love it.
You are going to be in that story, but you're going to be in that story across this community because it's coming. Like,
that's awesome.
It's coming. It's coming right now. Let us build the infrastructure for you. You just continue doing your work. And they're like, well, it only takes like 4 or 5 hours. I said, but they've been waiting 2 years. Waiting 2 years to get this door wide and to be able to take a shower in their primary bedroom. So I know there's independence here, but also, like, what is the mental health impact of this?
Yeah, but you could come back on the show. We could do a whole another hour on that topic.
Right.
All right, my friend. Super love what you're doing. RosariumHealth.com. Cameron Carter, also available on LinkedIn if you want to connect with them there. Anything else? Any other social pages? Any other?
We tell people Rosarium Health has a LinkedIn. We put a lot of blogs on there. We put we use it as a knowledge exchange. So if you want to go, on Veterans Day last year, we put every single veteran grant for home modifications. Cool. We do a lot of work to help folks understand what are the modifications they may need in their garage. But yeah, LinkedIn is the one that has some of the best content for us. And then we'll be launching some of our social media LinkedIn, Instagram and Facebook starting in January.
Good.
So.
Okay. Cameron, thank you so much for sharing your story on the show. I really appreciate it, man.
Thanks so much, Steve. Appreciate you having me on, and look forward to connecting soon. All right.